Timmy, thank you so much for your time and welcome to ENCA. I think a lot of clarity here is needed with regards to this decision made by the Medical Aids Council. Just give details perhaps with regards to this decision, which I understand is under new guidelines affecting mothers and newborns.
Good morning, Tumelo, and a warm good morning to all your viewers. Thank you for the opportunity to clarify. The CMS had, at the onset of this pandemic, sought the approval of the minister, and he had since consented to gazetting COVID-19 a prescribed minimum benefit condition. And follow on to that, we then went to develop funding guidelines. And these guidelines are usually latching onto the leadership that we get from guidelines existing from the National Department of Health, as well as the NICD. And so our funding guideline seeks to clarify what constitutes a prescribed minimum benefit, a PMB level of care. And these are benefits that must be paid by all medical schemes, irrespective of option type that a member or beneficiary might belong to. And so specifically on COVID-19, at this time, with regards to newborns, the evidence is very weak as regards vertical or congenital transmission of COVID-19. And as such, we do not deem the funding directly of newborns as PMB level of care. However, all our guidelines on COVID-19 is health worker initiated when it comes to testing. And so once a health worker, whether a doctor or a nurse, decides that there are the presence of certain symptoms as seen in the NICD guidelines,
right,
he or she will then initiate testing. And this is exactly the case for newborns.
So for clarity's sake, then again, Timmy, you're also saying that tests can still be conducted for babies that are either unwell or are symptomatic?
Certainly. We are saying that the threshold for testing in newborns should be very low. And as soon as any symptom based on the NICD guidelines are detected by any healthcare worker who looks after these newborns, these tests must then be consulted and they must then be paid for fully without co-payments by the medical aid schemes that the member, the mother or father of the newborn belongs to.
Right. So for the mothers, the fathers, or even, a couple that is concerned and just wants to, do all due diligence when it comes to their unborn baby or their new baby in this regard, they would then have to pay from their own pocket to conduct those tests.
Well, yes. In the absence of any health worker-led initiative to conduct these tests, they do not then constitute prescribed minimum benefits level of care, and as such, scheme rules will then apply, and these will then vary from scheme to scheme and from option type to option type.
All right. Timmy, I understand that there are also other, specific exclusions here, which are provided for by the Clinical, Unit Council of Medical Schemes. And I just need you to perhaps point some of them, just so that our viewers are aware, which will, of course, make payment for tests subject to scheme rules. Can you mention some of them? Okay.
Well, I think one of the most important one will be a member-initiated testing for COVID-19, for instance. So this member is unscreened, is unreferred by any healthcare worker, be it a nurse or a doctor, and asymptomatic as well, ending up in a negative result. So that scenario would be subject to scheme rules. Another example is an employer-initiated COVID-19 testing, where there is no symptom, the patient or the member has not been referred or seen by any healthcare worker. Such tests as well, when they turn negative, will then be funded according to scheme rules and as a discretionary benefit.
All right, then, let's just leave it at that. Thank you so much, Timmy Mudupe, for bringing us that clarity. That's the Clinical Unit Council of Medical Schemes Senior Manager, Timmy Mudupe.